Yeah, I was like, wait, where's
Melissa
Melissa?
joins.
Well, she'll join when we can. I'll look for this post that I can repost, and then we can officially go live and get started. And when Melissa joins, she joins.
I
Cool.
think
Yeah,
we're
that's-
actually live right now.
that's fine.
because
Hi,
there's
everyone.
people here.
I'm glad. Hot mic. Cool.
It always takes a minute or two to like show up on the words on.
Cool.
Here we go.
There we go.
LinkedIn.
Yeah. Cool. And I'm going to do that in a second.
Lifing is hard today.
There we go.
Here's Melissa. All right.
Probably should have told her to join like 5 minutes early to get the mic set up, because Riverside is great, but it's like kind of a pain in the butt to get everything set up right.
I feel like we're just phoning it in.
I come
every week.
very prepared. I don't know what you're talking about. I'm ready for it.
At least one of us.
It is noon my time instead of 9 a.m., so I think that helps.
That's, you know what? That's fair. I have not had enough coffee. I blame my lack of coffee. All right. We're now live on LinkedIn. Hi, Melissa.
Oh, Melissa is. I don't see Melissa.
You're muted. There's no sound for you. So we're just gonna keep it that way today. All right. Okay, and people. Oh, we lost Nilo. Okay. You might have to leave and come back. I think it's just the Allison show today, everybody. We're clearly keeping up real well. Yes, Barker. Yes, we're always well prepped with jokes. At least we got that going for us, so. Give my joke right now because it's gonna be like, no, like Melissa won't pick up our. Sorry, Mike. Well, I got kicked out because there wasn't room for Melissa this time. Oh, it really is just me. Hi, everybody. I am horribly unprepared for today. Story of my life. I feel like FDA is. Thanks, Alan. I feel like FDA is in a world of pain this week. Just a lot of things changing. I know that they're hiring, which is really exciting. I have noticed a lot of my friends at FDA that are in the director positions and whatnot are actually posting job openings. Of course, you have to be in DC. They're not allowing this remote work shenanigan that they allowed during COVID, but I know that there's a lot of students. I gave a talk last week at the University of Florida, which was awesome, and there were some people in that room that were like, I want to work at FDA. That looks awesome. And so I was like, yes, go do it. All right, look.
Were you in Gainesville last week?
Gainesville. Gator Chomp.
Can you hear me now?
Wow.
Yay!
Yeah.
Yeah? Okay, good.
That's cool that you got to go to Gainesville.
Yeah. So fun fact I didn't know about Gainesville, Florida, is that there's actual like just alligators like that just like roam around campus, and when they get too big they like move them somewhere else because they don't want students to die. And I was like, that's a thing? And it is a thing. They have like actual alligators just roaming around like we have skunks here in San Diego, you know? Anyway,
Yeah.
blew my mind.
Maybe they should rename San Diego State to the Skunks.
Actually,
It's like the Florida Gators. Be fun.
yeah, so the Aztecs. Melissa Hall, welcome to Trying to Keep Up. This is where we'll cut. We'll cut to this point. 5 minutes in.
Yeah. That's
I have
good.
to tell you, this audio is awful here. It keeps saying that it's trying to reconnect. Is it audio bad on your side?
No, it's fine. What?
It's fine. We can hear
We can
you.
hear you fine. Yeah, and Riverside FM will like will record in all three of our computers and then like have a beautiful crystal clear image and sound once this actually gets published somewhere else. So Melissa, I'm sorry your sound sucks, but we can hear you, and I would love to do a quick intro. Oh, that's my voice.
Yeah, that's just Allison. Sorry. I did have to leave and reconnect, Melissa. Yeah, I think she's gonna have to. I don't think there's enough. I don't think there's enough room. Alan's asking if that's a Houston TMCI shirt.
I love their
I don't even know what
swag.
that
Every
is.
time where is it? Every time I go, they give me cool stuff.
I need to be cool like you and get invited to go places. I never leave Pittsburgh. I have this office.
I'm so sorry.
Which is cool. Actually, it's a nice place.
I know. Is that an actual office or is that in your home?
This is an actual office. When Rowan was born, she took the office, so I rented office space at like a shared office that's walkable down the street. So like I can go home and come back here in like less than 10 minutes.
Yeah.
So that's nice.
That's very cool. I will say it's hard to work from home. Like I have to go fold some laundry after this, you know?
Yeah. Well, you're always in a different room when we're in here. We've got new art this week.
Yeah.
Which is fun.
And Caitlin asked if this is my home. Actually, this is my bedroom. And we always have nice art, so that's and I love you mentioned last week. Thank you.
Yeah. You also have an awesome house, which I've gotten to be. It's pretty sweet.
I can see the ocean from where I'm sitting right now. So
Yeah.
everyone suck it. All right, so let's do.
While we're waiting for Melissa to come back on.
Should we do jokes?
Okay, cool. We can do jokes while she's getting all.
Okay, are we good now?
All set up.
I can hear you. Can you hear me?
Yeah.
Okay.
We could hear you before too.
Okay.
We
I think
caught the
so. I had
bok,
like
bok,
a
bok.
VPN going on. I guess that's why it was like, we don't like your VPN. So
Highly encrypted.
Cool.
By the way, I mean, maybe it's a cyber attack that you're experiencing, Melissa. Did you hear that Stryker?
Great.
Oh, yeah.
Stryker had a huge
Yeah.
cyber attack this week.
I was trying to reach out to people this morning and haven't gotten a good response. But yeah, like apparently Iran backed cyber attack that anyone that logged into their computers yesterday had their entire system like wiped. I don't know if we've confirmed it was like that's who it was or whatever, but that's what the news is saying. I haven't gotten any response from the Stryker people. I don't know, Allison, did you reach out to anyone?
Just had, like,
Yeah.
people were sharing some news clips, and I was like, whoa, that's scary.
Yeah.
Go after
So.
people's health, like the health facilities.
I think it was a little bit of who's on the board at Stryker and what they back and things like that. There's some more. I got some more information this morning, but rule number 1 is going to be broken if we talk too much about it, which is trying to avoid politics. But it is crazy that like the first major like publicized cyber attack on this is a healthcare company.
Yeah.
Yeah.
But let's go to Melissa. Melissa, tell us who you are and what you did at FDA and what you're doing now.
Sure. Okay. Hi, everybody. What do we have? 5 people in the audience right now? All right.
I think
The best 5 people, though.
3 of those are us.
Is it 3 just us?
No, there's also people on LinkedIn that are watching, but yeah,
Awesome.
Thousands of people watch this afterwards, so don't worry.
There are dozens of us.
I'm Melissa Hall, and I've known these two for many years now, actually. Oh, I like how it says awesome dude and medtech hype woman.
Yeah, you can
That's
change
amazing.
yours too. Allison Kumar was regulatory princess, so if you...
Oh, I like that.
That one's taken. Sorry.
So I'm ex FDA, as you know. I worked at FDA for 10 years in various roles. I was the lead reviewer in orthopedics. I actually didn't cross paths with Allison. I think I must have taken your spot, Allison.
Small shoes to fill. Very small.
So after Allison left, I took a spot in orthopedics and was a reviewer there for 5-ish years. And then I think another Caroline Rim, who was on this podcast, a few weeks ago, she was my boss. And when she left and went to a different area, I actually took her spot as a manager of the group. So I was the branch chief. I know, right? Just keeps moving. So I was in that role for a couple of years, and then moved over to DICE, the Division of Industry and Consumer Education. So I was like helping educate industry and answering all the calls that were coming in from industry perspective, and doing various conferences, helping people understand the processes within an FDA, because it's hard to navigate everything. And then I finished out my career at FDA. Not saying that, who knows, maybe there's a future to go back. I'm not closing the door. That I was in policy area, so I was in the 510K, de Novo, 513G, kind of overseeing different products across all of CDRH, and some of those nuances that were coming up and offered policy perspective, making sure that things were being outlined the same across the board, which I think Mike and I just recently with our call yesterday may not be the case across the board, which I'm sure you all have talked about. So after I left FDA, I decided to leave FDA in the end of 2023. And the reason for that was I think there's a few different things that I kind of saw in myself in the different roles at FDA that I could offer more. I liked the idea of people asking questions and me trying to find those answers and finding where those nuances were. But you know, in the agency, you're kind of bound by, you can't really offer consulting kind of perspective. That's just not your role. And I wanted to see, I thought that I could offer more in that perspective. So I wanted to see what I could do on the outside. And I kind of look at myself as kind of associated with the FDA in a way, that I'm making sure that these companies, these startups, are approaching their regulatory processes the right way that makes it efficient for the reviewers within FDA, and also for the companies to get through the process. So I've been in that role for a little over 2 years now as a consultant in my own business, Terra Regulatory Consulting, and I do some subcontracting with Nilo and some others, Caroline Rim I mentioned as well, with Avera, and I'm enjoying it.
I love that. And I love you. You're the I'm so happy that you've just grown. I can't believe it was 2023 that you left. It feels like yesterday, and it feels like 20 years ago, so I don't know.
Right? It is kind of crazy that I'm entering my 3rd year of navigating this role of figuring out my own business.
Yeah.
It's crazy.
It's awesome.
I do remember you calling and going, is this something I can do? And I was like, yeah, absolutely. You'll be fine. And I can't believe that was, because I think it was, fall of 2023 is when we were talking about that. I can't believe it's been, almost 3 years.
Yeah.
That's wild.
Anyway, welcome. Do you have a joke?
I know, right? So I had to do just a little searching here. I was like, this is crazy. A regulatory joke? Like, how nerdy are we? It's not really a joke, but it's more like people outside of the regulatory space will ask, what is it that you do? And it might sound fancy that you're like, oh, you're helping these companies get their products to market through the FDA, and these are products that you see in hospitals and doctors' offices and all these things. It sounds really cool. But when you kind of break it down to what you're actually doing day to day, is I'm helping companies, and this is kind of in the context of a 510K, when you're saying I'm the same as something else that already exists out there. You're putting their hugely innovative products up against FDA and writing 300 plus pages of documentation that basically says, look, I'm just like this other product that exists.
So true. Like, marketing people take everything you know and flip it on its head and say you're not innovative and you're exactly the same as what you have that's already out there.
Yeah.
Yes.
I mean, historically, regulatory and marketing do not get along, right? Which seems ironic that I started like a marketing media company recently, but I'm like, it's so important. Like, we have to,
I have a big slide deck of why regulatory people should go hug their marketing people, and it's all about why they should talk to each other, because marketing people have communication skills that a lot of engineers don't. And just tell them what they need to sell, and it sells substantial equivalents. So they're pretty good at it most of the time.
I like that.
Yeah.
Okay, my joke is I just got off the phone with a client in EU, and what's the best thing about living in Switzerland? I don't know, but the flag is a big plus.
Oh my God.
I like that. I'm a big flag fan. Mine's definitely the worst this week. What do you call a $2 chicken? Buck buck.
No.
Oh my gosh! Okay, my kids are gonna freaking love that one.
Yep. So, Melissa, for the future, they don't have to be regulatory.
Yeah.
We've had fart, animal jokes and fart jokes have really been
like
top
the two
tier.
winners. Oh my gosh. Okay. I already touched on the first bullet that we had in our notes. CDRH is hiring.
Yeah.
Someone said 400 positions, but I'm like,
but really advertised on LinkedIn and not USA Jobs. So for the 4 other people who are listening, like, tell your networks to follow us on. I'm trying to repost anytime I see friends like do it. Just like, it's not the old school like go apply through USA Jobs. Like, reach out to the people who are posting it on LinkedIn and be like, hey, I'm applying. Like, do the thing that way.
Yeah.
It'll get you places.
100%. You know that I found my job at FDA on Craigslist?
What?
That's not a joke. Yeah, like Ron Brown, who was one of the, like, he had posted on USA Jobs, posted it elsewhere, and then he's like, well, I'll put it on Craigslist. And I was looking for any job I could find at FDA, and like weirdly, I found it on Craigslist first before I then went over to USA Jobs and applied.
I found my roommate I lived with in DC for 6 years on Craigslist when I was moving up to and he's a good guy.
Yeah.
So,
Craigslist
he was in my wedding.
anymore?
I think it is. I think it still exists.
Probably just for like nefarious things. I don't think people still use it that way. I think Facebook Marketplace.
What do people use it for? Right. Marketplace, I feel, is like what people use now.
Marketplace and misconnections.
Yeah.
I saw you on the...
Yeah, misconnect.
saw you on the show.
I hope the misconnections still exist on Craigslist.
Okay, we're going to go down the rabbit hole after we leave this call today.
Yeah.
New de novos. We talked about the live vac last week, but I didn't see any new ones today.
I didn't either. I did want to, before we get, I didn't see any either, but you do have the note here about it taking a long time for summaries. Is that your note, Allison?
I must be
That was me.
Yeah.
Almost. Yeah.
Some of them are.
Yeah, there was one.
Some of them are coming
What?
out. Some of them are taking a long time, and then other times, like, it'll come out the week, like, that week. So, I don't know.
Yeah.
We should talk to Peter Yang.
Yeah, we talked about this before on the PMA stuff. I think there's just a lot. They fired all the communications and like publishing staff, and I think we've had a couple of de novos and PMAs over the last couple months that the SSEDs or the summary documents are just riddled with errors. So I think there's been a lot of things that are going back into contention. So they get posted and then back or stuck in like arguments post approval before they publish. So I think that's part of it. But I also know that, like, last year around this time, Veronique Lee, who's also, she's at HPM now, because we were all complaining about it in our Slack channel, and then she wrote a big article that got published kind of to like several things, and then all of a sudden the de novo summaries were all caught up because they were like 2 years behind. It was driving me nuts because I had a couple of clients that were like waiting on the summaries for planning purposes. We're like, well, why would we do a huge regulatory strategy? We're just going to wait for the special controls to come out, and they weren't. And so she wrote a huge article about it, and it like, yeah, it was one of those things that like someone read it and went, wait, we need to do something about it. So maybe we need to get her to write another article.
It's starting to be very neat.
Catch up again. Yeah.
Like that fire under FDA. New PMAs. Who wants to talk about the Claire OCT?
I put it in here so I can quick talk about it. It's the Claire OCT system is an adjunctive 3D imaging tool that basically gives you the size and location of breast cancer tumors or potential suspicious lesions. So it's got artificial intelligence. It's supposed to be used concurrently with physician interpretation of the images. And it's also just used in conjunction with other standard methods of and evaluating the margins of excised lumpectomy. So really checking to see if you got everything you were intending to go down there and get as well. I thought this was really interesting because I was shocked it was a PMA. A lot of these similar types of tools, and it seems like AI-enabled imaging systems that can kind of help detect different things are going the other way with less regulation. And I was just really shocked that the group kind of pushed this up to a class 3. So Melissa, to your point earlier of your old role in submission consistency, I think this is one of those ones that's like surprising that it ended up there when there are other wellness-based tools that can, scan for like, detection of like skin disorders and things like that. So it was interesting.
This is kind of crazy because the one that I was talking about for a de novo was the Artera AI that talks about like prostate estimation if you get prostate cancer, and it like estimates your future of the possibility of getting it. And it looks at images and makes an interpretation. And I believe there's AI in it as well. So it's like, what is the risk level here it's crossing over to PMA land versus de novo land when it seems like it's on the surface? I'm sure if we dug in deeper and found it, we could maybe uncover it.
It really could be the review team. The women's kind of breast health group at FDA is very conservative. I've had projects go in there before. So it could, and maybe the company themselves never really fought it. Maybe they thought there was an advantage to being PMA instead of class 2 and just kind of went with it. But I was really surprised when I read through the SSED on that it ended up being class 3.
You read through the SSED, 300 and some pages. I'm just kidding, Mike.
It was not that long. It was only about 40, and I skimmed it. And I took 15 minutes. And I told Allison before you joined. I read it. I come to this call prepared, not just rolling out of bed like Allison over here.
I'm not calling Mike out. What I'm saying is like those documents are so long, and you have to really be focused, right, to sit there and read through them. I mean, you sometimes need to in order to help your clients, right? Like that's part of your job. But man, it's hard. It's a hard read sometimes to get through all those pages.
Not for this one. I have done the thing where I needed to read through it, at least for a first time for a meeting, and I did download it to Adobe, and Adobe has that pop-up that says, do you want us to make this into a podcast for you? And I said yes, and I listened to their talk on the SSED, and it wasn't perfect, but it was like great for a dog walk, and it got me 80% of the way there, and I was prepped for the meeting.
That's really cool. I haven't used that function.
Yeah, I thought it was going to be complete BS, and it was actually pretty good. So,
thanks for that plug.
Yeah,
that's good.
Yeah.
Good to know. I'm always fascinated. So there have been cases where things were submitted as a PMA, and FDA was like, "No, this is a de novo. Withdraw and resubmit as a de novo." They rarely do that though, right? Because if you don't have a predicate, you are well within your right per the regulation to submit as a class 3 PMA. It's up to you historically if you wanted to request automatic reclassification via the de novo pathway, right? But I've had reviewers say, like, we're going to save us all the heartache here of having to reclassify this once the PMA gets approved, and then we've decided that it's not, class 3, which is really hard to do, right? Like, that process takes a long time. I mean, we've also probably been in the position where FDA we were like, this is a de novo, and they're like, no, this is a PMA. But yeah, it's interesting to me when they're like, yeah, we'll accept it through the other pathway.
We just had one of those last year. We submitted a PMA shell for a modular, and the review team went, why do you think this is a PMA? It's a de novo. And we're like, we thought you told us it was a PMA, because they did in a previous Q sub. But then when we kind of actually went to it, they were like, no, we think it's class 2. We're like, yes.
Yeah, and
it worked out well.
Some companies would love that's like music to their ears, and others would be like, no, we want to be a PMA because we want to create the moat, and we don't want to like allow other people to predicate off of us. So anyway, there's always strategy in there. All right, CDRH new. There was actually quite a few press announcements, or I should say, I always go to the press announcements first, and then the CDRH new. And one of the things that came out yesterday was that FDA launched a new adverse event tool, lookup tool. It looks like it's not for devices yet, but it's, they're talking about, again, more transparency, like how do we get more information. So it's a FDA Adverse Event Monitoring System, or AEMS, or AIMS. AIMS. Yeah, and I feel like Dr. McCary has been putting out a lot of like press releases and little videos. He had one where I was like, it was like he was in a food court. I was like, where are you, sir? Anyway, so that was interesting to see. For CDRH new, who wants to talk about the risk-based inspection and workshop?
So it was yesterday. Oh, no, not the risk-based inspection. I don't know anything about that. I could talk about the CDS. The clinical decision support workshop was yesterday. They kind of just walked through the guidance, and I caught some of it. I'm going to watch the replay of it. It was pretty quick. The way that these workshops are going, they're not taking live questions anymore. They're having people email in, which I actually think is probably a good thing, because some of those live questions often went off the rails, but it makes them so that they're really really top level on the CDS, the workshop. So I am interested to see more about where these go. So the clinical decision support thing, for if you're not used to talking in alphabet soup, so the workshop, but it's still interesting guidance, because there's so much stuff out there right now that's like, you're at risk of blank. We're going to tell the doctor based on your record that they should test for this or look at this and all that kind of stuff. And it's really unclear looking at like the regulatory history if you're regulated or not. And so the examples that they provide in the new guidance are pretty helpful. I don't know about you guys, but I feel like people come to us with those kind of questions all the time for those types of products. So.
Same. And I think that's what that guidance, I think the most of the updates were the examples to kind of, I'm assuming based on some of the questions they got internally to FDA for the devices. What is it called? It'll come back to me. But basically they can ask FDA. I lost my train of thought. Or what the name of it is, but they can ask through email whether or not it's a device or not. So I think that might be where, or it's sort of speculating that maybe where some of the improvements came to that. Speaking of that, have you guys ever used? So the FDA website has what is it? It's a software tool to determine the digital health policy navigator. Have you tried using that? Or have you talked about it?
We haven't talked about it. I've used it. It's been around for a couple of years now. We've used it as a good way to justify our position, because I am of the opinion that you don't ask the FDA how they want to classify you, because they'll always tell you they want to regulate you, because they're regulators, right? The hammer nail situation. So if you have the opportunity to self-classify, I think you should do it with good advice. So I've used the tool to kind of get the output to say, hey, the FDA's tool says we're clinical decision support, or we're enforcement discretion, or like whatever the output is, and then put that into the justifications so that sits in their DHF or just in their lobby if they're totally not a medical device, just in case the FDA ever calls and says, it has come to our attention, and they can go, here's our response right away to show that they've thought about it. So that's where we've used it kind of extensively, actually.
Yeah, I think it's really helpful because it crosses over many different guidances that are out there.
Mm-hmm. It's good to hear that they're kind of keeping it up to date too, because there's been so much updates with policy around digital health, so that's helpful.
Next thing, did you guys see there's a new guidance document that comes out tomorrow? So this is future.
Breaking news.
Breaking news. I don't know. They always do that, right? When they're like, issue date is on the 13th, but it's actually today.
What is it?
Medical devices with indications associated with weight loss, pre-market considerations, guidance for industry and Food and Drug Administration. So it really is for CDRH. It kind of dovetails. What's interesting is it dovetails with like FDA going after a bunch of the compounding and like the GLP-1 companies as well. But it also, that guidance document, I feel like didn't we talk about a PMA? There was like a PMA or Novo that came out recently that was like another balloon that would inflate within the stomach. So
yeah.
Anyway, these are kind of the device-specific guidance documents that will go along with a certain device type. So that's what we're seeing with this. Various market considerations that you'd have to do and follow. Go ahead, Melissa.
I wonder if that one is related to like the apps, the digital apps that go with some of these compounding facilities, laboratories. They also are like, here's an app, tell us how things are going, or it might have some marketing things in there that, I haven't even looked at the guidance, but I don't know if I guess we'll find out, right? 'Cause
I put the link in the chat, but it talks about the Pediatric Advisory Committee. They had various, they engaged with stakeholders regarding how we can help ensure patients have access to appropriately safe and effective devices indicated for weight loss. So it lists the 4 main product codes that are within the scope of the guidance. It's for the implants, aspiration therapy system, neuromodular for obesity, and oral removable retainer for weight management. So
okay.
I'm sorry. There's 6. There's 2 more. Ingested, as well as the altering gastric anatomy. So I'm assuming that's like the lap band.
Okay.
Anyway.
There was a good question in the chat, and I tried to answer it, but for the AIMS thing, they were asking if that's going to replace mod or impacts to the manufacturers with mod kind of, I think they've got back-end mod API and things that auto-upload and things like that is going to break that. What I wrote in there, but I'll open it to you, my assumption is it probably wasn't thought the whole way through, because that happens with FDAs generally. That's not even a recent thing, just not considering the things that industry has built to work with the FDA. They're just like, oh, this will be new and helpful, and roll it out without considering that they're going to break old compatible stuff. But I think the AIMS thing, from what I read, is going to sit on top of the mod database and just make it easier to search, but I'm not sure. I don't know if you guys had more.
No, that would make sense, though.
Okay, well, good question, Kate. We'll come back to it with more info some other day.
Again.
If we can.
Who knows? I think, don't people know that, like, we have no idea what we're talking about? No. Melissa, what was your brain fart? Go ahead.
Yeah, no. So earlier when I was like, oh, you can ask FDA, I kept thinking device advice, and I'm like, that is a good resource to use because it's a bunch of web pages on the website. I was like, I was part of this mailbox. Why can I not think of it? Device determination. So if that's what Mike kind of was talking about, do you really want to ask FDA what your product is? But some people do, and kind of even want to get an idea, is it a device or not? So there's, I oversaw some of this mailbox with a few others as part of the policy team, and there was crazy stuff that would come in nonstop every day, and we would be using a lot of these guidances to try and figure out, whether it's a device or not.
When in doubt, did you just say, yeah, sure, send it to us, or submit a Q sub so we can figure it out more?
Of course.
Okay, just making sure. That's what I would have guessed, but
yeah, if it's not definitive, you don't. I mean, I think about it from the perspective of public health, right? That's the goal, right? So protection.
On the agenda, there's something interesting that I don't know who put it in here, but it's cool. Talking about Lindsey Vonn's X-Fix system.
Yeah, that was Melissa. Come on, Melissa.
Yeah, let's talk about this. This is cool.
Yeah.
Man, when she posted that picture of her leg in that hospital bed with all of those screws and rods and craziness, I think I was sitting with a group of hockey moms, and we were talking about it, and I just totally geeked out, and I was like, yeah, this is what this is for, and it's a temporary thing. They're like, it looks so crazy, and I'm like, yes. I mean, X-Fix systems, I didn't review them firsthand, but just thinking about the practical use of them, it's necessary. It's a necessary step to the process of healing huge, crazy fractures. It's something I think about. I am not an avid skier at all. I actually kind of learned how to ski later on in life, and thinking about this, my learning hockey later on in life as well. Hockey's actually helped me with skiing, being able to kind of go back and forth, side to side. But it's something I think about. I'm like, oh my gosh, I hope I don't get injured, because I could imagine if you get some sort of awful fracture like she did, and having to lay in that bed with that X-Fix in your leg with all those pins and it's literally holding all the pieces together. There's fragments. It's not even together at all.
It's a little terrifying. But it's amazing that medicine can actually do that. Right? Oh, cool.
Yeah.
I'm so glad that I don't live 100 years ago when I would be dead. I feel like I've been talking to people recently that everyone's like,
yeah,
I would be dead. Would be dead.
Yeah.
So, yeah, very grateful.
Mike, you're muted.
He's talking to himself.
I got to go find the picture that you're talking about, because I didn't see it.
Oh, really?
And yeah, no, I'll have to go find it, because when it got up there, I was thinking more of the almost like a brace type thing that she could move around on, not
no.
like a. Yeah, this sounds like something crazy.
It's like Frankenstein. She looked like Frankenstein laying in this bed with her leg, and they even had to fillet it open because it was so badly injured. They were talking about her losing her leg.
That's crazy.
It was fascinating to me to look at that, and then she also posted recently, her rehab, and I think it was her father that said she'll never ski over my dead body. I basically have to be dead in order for her to be able to ski again because of that crazy injury. But so they went back in after they did the X-Fix, and I don't know how long she had that in her, but it was one of many surgeries that she had to go through. And I think the final surgery was basically putting in all the plates and screws into her leg, and she has multiple on her tibia and fibula, to kind of hold them all and hold everything in place and help it heal. And then she was like showing videos of her doing like leg lifts on machines with, you know, these plates and like from her injury. It's just insane. That is.
Which is also, all those things are medical devices, right? For like physical therapy and like all of like the tech that goes into actually getting her back on her feet. Like, I love it. I mean, I don't love it that she had to go through all of that, but I'm like, oh, it's so interesting when you get to see all of the things that I feel like the three of us have worked on. Like, you've seen a device that you reviewed at FDA, like, in somebody, or like you've seen images and stuff and you're like, I worked on that, you know, or like I reviewed part of that, right? There was like a surgical robot recently that I was like, I reviewed section. And it's like, it's so cool, and it's also like, yay, those things are actually out there helping people, and hopefully, like, you know, helping people not die sometimes.
Yeah, I mean, that's one of those showcases, right? Like, it's because it's Lindsey Vonn, you're getting to see some of the things that are used in everyday life when you think about military or, you know, accidental injuries. Like, they are everyday products that are used to save people's lives, and it's pretty cool.
Yeah, I agree.
My uncle had stents over the winter, and I was like, "Can you ask your doctor which ones they were?" You know, I was like, "They were the ones that worked. I helped get through the FDA when I worked for Biotronic, so it was cool." But I will say, when we put up when we put up external,
there's a bug. Giant mosquito hawk just landed on me.
Hey, put $1 in the swear jar.
Oh. Goes to startups. So.
Yeah.
Can we do a quick rapid fire? I don't want to have
it.
Discussion about the following things I'm going to talk about because I don't want to. One of them is the FDA making a major step to streamline biosimilar medicines, like the generic versions of biologics. Vinay Prasad has been ousted at FDA, or he's decided to leave, retire, so that definitely impacts CBER. And there's just, I feel like every time we turn around. Also, I think it was Laura Rose posted something on LinkedIn that she was like, "You want to know what's going on at FDA? I got the tea." So like, she just had them posted. I was like, "Stay tuned," and I'm like, "Oh, I'm like getting my popcorn."
When did she post that? Oh man.
Yeah. Okay. Well, now I know. Yeah, I'll have to figure that out. I actually do any of you guys pay for the subscription at Stat?
I should.
I think I'm biting the bullet because they've been posting all sorts of like insider stuff, and like I feel bad like leeching off of people's free articles at this point. There's enough there that I'm like, it's not that expensive. I think I'm gonna sign up for it because they've got all the insider information and seem like good people. Yeah. Should probably support them.
Next week, Nilo, you and I are going to be talking in IRL, or in real life, because I'm going to see you at LSI next week.
Are you going to come up?
Yeah.
That was still... Okay, sweet.
Yeah, and there's some folks I need to meet with, and also I got invited to some parties.
So it's not just me.
It's not just you.
So, worse. I didn't even get invited to the parties. No, I think I did, but I don't know. Find out what parties you're going to.
I'll send you an invite. Yeah. I know a guy.
Yeah. Carolyn will be there too. I'm bringing Carolyn.
You bringing the baby?
Nope.
You're bringing the kid?
No, my dad actually gets in tonight, and he's going to stay at the house in Pittsburgh for the week while we go to California. Because Carolyn was like, I get to stay in a really nice hotel. Yeah, I'll do that.
Yeah, it's a nice hotel. I'm not going to stay this time. I'm just coming up because I'm just south of you. Yeah. Other thing, I'm going to be at Society of Toxicology, SOT, and I'm also going to be one of the moderators for the Neurotech Forum. So if anyone's in SoCal and is going to Neurotech Forum, I think like Vivek Pinto and like some folks, Jojo Platt, they go. And so, nice. What conferences are you going to, Melissa? I know you and I are going to be at MDI, or all three of us are going to be at MDIC.
Oh my gosh. we're all staying at Chenman's
We're all
house.
staying at Gemma's house. He doesn't know,
Yeah.
but we're all going to show up with our
No.
sleeping bags.
Yeah, I might stay. I might stay at Dave McGurl's just because I might bring Rowan, and I don't want to show up with a sleeping bag and a kid, so I can at least leave Rowan at Dave's.
Maybe we should like have a little post of like we will be attending the following because it'd be fun to maybe spill some tea and talk about like how we're trying to keep up. But IR.
I feel like
I know I'll be at AdvaMed in the fall.
Oh, sorry again. Say again.
I said I'll be at AdvaMed in the fall just because
Okay.
I just finished reviewing all the proposals. I signed up to like do the reviews so that they let me have a free ticket.
I didn't know you could do that.
How do you get on that gig?
Yeah.
They let you do that?
Spoiler alert! Spoiler alert! Most of what I reviewed was AI and medical devices because I got stuck on the digital health one, and I was like, if I read one more proposal about how AI is transforming a hospital, like I need one of these proposals. Any of you can do it because you're all the same. I don't know how to score this. Someone should talk about it twice, and that's it. I don't need 67 of these.
You could have just a
How many
massive
proposals?
panel, just like one giant panel.
They could all be in the same room together for
Yeah.
everyone that proposed it and just be like, talk amongst yourselves. The rest of us will be somewhere else.
Well, I found out yesterday that my RAPS, what I proposed for a RAPS seminar got picked. So I'm going to be at RAPS.
Nice.
Nice.
Dropping some truth bombs about de novos and 510Ks. So
Cool. I didn't meet the deadline even after they extended it by a couple of days. It's so early. It's right after Christmas.
know.
It's like January
It's
6th.
cool.
I'm like, I don't have time.
God, who's thinking about stuff? Especially if people are JP Morgan. Like, it's like, oh.
Yeah.
Yeah, the timing's really bad for that.
For a conference that's in October, it's like things will change by then.
It's true. By then, like all of these topics will be just useless. They'll have replaced all the reviewers with chatbots. By the way, there was a correction from last week when Monica joined that people are saying they're phasing out or they got rid of like Claude, or because Elsa is Claude based, that they're just like they were gonna get rid of it altogether, and other people are like, no, it's gonna be phased out over time, but that they're still gonna have Elsa, but maybe it's not gonna be under Claude. So interesting.
Oh,
Yeah.
interesting. So they're gonna move it to a less secure one? That can't be good.
That is unclear to me. So,
I would be a little worried if I was like a med device, like something like truly innovative, and it going into these LLMs and like how much that's getting shared outside the system, because we hear about it all the time about in other industries about how people's like data ends up showing up in other people's like responses and stuff.
Yeah.
Probably not the best.
Yeah.
Anyway.
Yeah, good times. And by the way, I get to hang out with Dr. Weber tonight. He's giving a talk at San Diego
Oh, nice.
Regulatory Affairs Network, and he's going to be talking about real-world evidence. Wish you guys were here, but maybe I'll report back, because I'm going to use his talk to like help catch me up with like all the guidance documents and everything. He's going to do like a talk that's going to cross over for devices and biologics and drug, because all the guidance has kind of got updated at the same time.
That'd be really helpful.
That's cool.
Yeah, excited. I actually found a de novo. There was one, I was doing some research into de novos that were granted without any clinical data, and just like leveraged either publications or animal testing, and there's quite a few. I feel like it would be, maybe I should write something in my free time. I'll get on that. Write an article.
You could also, instead of writing a whole article, just send those submissions to Melissa and I so we also know what they are and I don't have to do the work.
I'm on.
Great. Thanks.
All right, everybody. I think that's all we got for this week. Was there anything else?
I don't think so.
I'll leave you with one joke then. How many hang on, where is it? Here we go. Oh my gosh, I have to scroll down. Okay. How many clickbait articles does it take to change a light bulb? I don't know, but the answer will shock you. recently posted like, when doctors say, doctors don't want you to know about this. This is a cool thing, and doctors are, he's like, yes, they do. And scientists want you to know. Like, we're not trying to withhold stuff.
It's literally all we
That's
do.
all we do.
Publish or perish.
Try to get information to you. So, yeah. I have seen an uptick in like clickbait articles and also AI generated like advertisements between like YouTube videos and stuff. I was like, oh, this feels real creepy. Thanks everybody. Thank you, Melissa, for joining.
Thanks for having
me. If you
this
need,
is fun.
How do people find you? Where do they go if they want to hire you?
LinkedIn, they can go and find me. My information's there. It says Terra Regulatory Consulting. Thank you.
Awesome. All right. Thanks, everybody. See you next week. We'll have Jim Kleinedler.
Oh, sweet.
Yeah,
Bye.
Bye.